How do bile ducts adapt after a liver transplant? Imagine your liver as a busy factory, producing bile to help digest fats. When a new liver is transplanted, the pathways that carry bile from the liver to the intestines need to be reconnected. This process involves careful surgical techniques to ensure bile can flow smoothly again. The main way this happens is through biliary reconstruction, where the surgeon joins the donor's bile duct to the recipient's bile system. There are two common methods. One is called duct-to-duct anastomosis, where the donor's bile duct is connected directly to the recipient's bile duct. This keeps the normal anatomy intact and makes future procedures like endoscopy easier if needed. The other method is connecting the donor's bile duct to a loop of the recipient's small intestine, known as a hepaticogynostomy. This is often used when the ducts are too small or if previous surgeries make direct connection difficult. These connections create a new pathway for bile to drain from the transplanted liver into the intestine, helping the body adapt to the new setup. Sometimes, the size of the donor and recipient bile ducts don't match perfectly. In these cases, surgeons may enlarge the recipient's duct or adjust the position of the ducts to make a secure connection. These adaptations are important to prevent leaks or blockages and to keep bile flowing properly. After surgery, the bile ducts go through a healing process. They may remodel and adapt, but this period can also bring challenges. About 15 to 20% of transplant patients experience complications like narrowing of the bile ducts, known as strictures, which can block bile flow and cause buildup. Bile leaks are another issue, leading to infection or inflammation. In some cases, the blood supply to the bile ducts is compromised, resulting in ischemic cholangiopathy, which can damage the ducts and sometimes requiring another transplant. Looking to the future, scientists are exploring ways to repair or replace damaged bile ducts using bioengineering. They are developing techniques involving stem cells to grow new bile duct tissue in the lab, which could someday reduce the need for full liver transplants or improve outcomes for those with bile duct diseases. In cases of liver cancer that involve the bile ducts, the transplant process becomes even more complex. Replacing both the liver and the bile ducts successfully is vital to prevent complications and ensure the long-term health of the new liver. Proper surgical connection and ongoing management of the bile ducts are essential for maintaining liver function and reducing the risk of cancer recurrence. In summary, after a liver transplant, bile ducts adapt mainly through surgical reconnections that restore bile flow. They undergo healing and remodeling but are vulnerable to issues like narrowing or leaks. Advances in tissue engineering hold promise for better repair options in the future. Always remember, each person's recovery can vary, so it's important to work closely with healthcare professionals to monitor and support your liver health.